section, we're going to talk about some of the frequently asked questions.
Dr. Greco, when will my pain and stiffness in my neck go away?
So that's a very interesting question. When we do the operation, we actually take your platysmal muscle and we sew it back. We trim it and sew it back so that you get a better neckline. It's not actually terribly pain, but it's stiff because there's a suture line that comes along this way. So when you turn from side to side, it'll be a little bit uncomfortable. Usually that'll go away in the first 2 weeks.
Also, why is one side of my face more swollen than the other side?
So that's a great question. We don't know why people swell. We do the same operation on each side. Sometimes it's because people sleep on one side or they lean one direction versus the other direction, that one side of their face will be slightly more swollen. Occasionally we've had to do more surgery on one side than the other side, but most people are pretty equal and will have periods where one side's slightly more swollen than the other.
And it seems also that I have these indentions on the side of my cheek and down my neckline.
So we put these drains in. They come one on each side and comes above your ear, down along your cheek, and then one on each side behind the neck, down into the neck. And it sucks slowly and helps fluid come out. When we take those out, sometimes you'll see the remnant of where the drain was because it had maximally removed the swelling where the drain is, where it's more swollen as you go away. And that'll all even out over the first few days.
When I touch my ears or like my side of my face, it's just a weird sensation. It doesn't feel like it did before.
So after surgery, you're going to have numbness. The numbness occurs because we elevate the skin from your face all the way down behind your neck, and your ears will feel a little bit funny. Your cheeks may take a couple weeks before the nerves grow back into the skin. When we do a brow lift, we actually release all along here, and we tug on the nerves. Sort of when you bump your elbow, you get those funny feelings in your fingers. Those nerves can have been stretched a little bit, and you'll feel a little bit numb and some tingling going all the way up into your scalp. Vitamin B6, 200 milligrams a day helps with that, helps with the swelling around nerves. And this will take a varied period of time. It can take anywhere from days to a few months before your sensation is completely recovered.
When can I go out to the grocery store or out to dinner?
Good question. So it depends upon exactly what operation we did and how many different procedures we've done. But generally the first 3 through 5 days, you're not going to want to go anyplace. Usually by day 6 or 7, you'll put sunglasses on and you can go to the grocery store. Usually by day 10, with a little makeup on, you can go out to dinner with your significant others. And by 2 weeks, most people feel comfortable going to a cocktail party with makeup on, and you'll actually look better than you did before surgery. At 6 weeks to 12 weeks, you're going to look even better as you become less stiff and more soft and natural looking.
Also, is it normal to feel like I still have staples in, but like behind my ears?
So after surgery, most of your sutures will come out day 2, day 5, and your staples and your post-auricular sutures will come out somewhere between day 9 and 14. Afterwards, you now have healing going on. There's sometimes still some crustiness from where the staple marks were. There's a little bit of scab formation along the incision line, or the incision line is firm because it heals. Massage, which we're going to teach you about, helps soften those scars and make it feel more normal. So that's just part of the post-op recovery period. Usually by 4 to 6 weeks, most of that has calmed down.
When can I resume sexual activities?
So it is important during the first 2 weeks that you do not have any increase of your blood pressure so that you don't cause bleeding. So there are certain kinds of activities that you're welcome to perform and be involved in, but you just want to keep your blood pressure down for the first 2 weeks. I hope this helps you in your post-operative care.